some of the most common behaviors we see in autistic children are often sensory driven, but then misinterpreted and misunderstood as behavior problems. What are some of these common behaviors and how should we be interpreting them?
So one example in particular that I like to work with parents to understand is the difference between a tantrum and a meltdown. So a tantrum is usually about wanting something specific. For example, access to a toy that you're not being given in the moment. Parents are usually very familiar with what a tantrum looks like. And the appropriate response in this case may be holding firm, remaining consistent, having clear boundaries. But then a meltdown, on the other hand, can be triggered by sensory overload. So in this case, the best response would be to adjust the environment to reduce what it is that's overwhelming them in that moment. Now, what's challenging about this from the parent perspective is that they can look very similar. They can both look like behavioral problems. My child is just having tantrum after tantrum, but the root cause is different. So the ways in which we respond to them has to also be different. And so I share this with parents, especially when they share that they feel like they've tried everything. They're getting reports from school about their child's behaviors, and they've tried responding to them in a way that you typically respond to tantrums, and it's just not working. They become more and more dysregulated. And it might be because there's a root cause there that's related to sensory processing differences that is going under supported.